Well, thanks, Beth, and good afternoon, everyone. So it's a big day tomorrow for many parents and thousands of kids across the region as our vaccination campaign for the 5 to 11-year-olds gets underway in London, Middlesex. You know, it's been great to see such strong demand when it comes to booking appointments, especially in these early days. And I'm sure we'll see the continued enthusiasm in the coming days and weeks. I'd like to acknowledge and thank everyone involved in setting up these clinics, making them so welcoming and kid-friendly. To a person, the feedback received from other age groups throughout the course of this year has been nothing but positive when it comes to how well these clinics are run. I know the feedback will be just as overwhelmingly positive from parents and young children starting tomorrow. And speaking of tomorrow, I hope you'll join me and thousands of other Londoners for the annual lighting of the lights in Victoria Park. It's not only a time-honored holiday tradition this year, it's proof of how far we've come. You'll remember last year restrictions were such that we could not invite the public. It was all very low-key and not at all like most of us were accustomed to. But 1 year later, despite a more contagious variant, we're able to share in this celebration together and carefully. There are a number of reasons for this, not the least of which is vaccines. In fact, I would suggest it's the most important reason. It's why the Hyde Park Santa Claus Parade is able to return on Saturday after taking last year off. And it's also why we're able to welcome back the Argyle Santa Claus Parade next Saturday. As mentioned, none of this was possible last year, and it's likely none of it would have been possible this year if not for the willingness of more than 9 in 10 Londoners doing the right thing and getting vaccinated. It's why, to bring it full circle, tomorrow's vaccination effort for 5 to 11-year-olds is so important and so meaningful. Once again, thanks, moms, thanks, dads, and thanks, caregivers. But especially thank you to the kids for protecting yourselves and all members of your family and our community by getting the shot. Well, that's all for me, and over to you, Dr. Summers.
Thank you, Mayor Holder, and for your comments and ongoing comments here during our media briefings. Good afternoon, everyone, and thank you for joining us for the media briefing today. I wanted to start my comments this afternoon by acknowledging some recent news articles regarding the work environment at the Middlesex-London Health Unit. It's been a challenging time to work in a public health unit. For nearly 2 years, we've been tasked with responding to the pandemic of the century, a pandemic that has dominated nearly every aspect of life for everyone in our community. At the Middlesex-London Health Unit, we've had to pivot as an organization from a primarily Monday to Friday 9 to 5 operation to an organization that needed to respond 7 days a week, 12 hours a day, 365 days a year to the ongoing risk of COVID-19 cases and outbreaks in this community, and the need to vaccinate as many people as possible. I am proud of how we've responded and how we will continue to respond to this pandemic. Our response is only possible because of our people, our staff. As a team and as an organization, we have strived to support them through these challenging years, recognizing the massive amount of work and stress that they have been faced with. To bolster the ranks, we've recruited massively and nearly tripled our workforce in an effort to address the substantial needs of our community and the work that continues to come in. We are continuing to recruit additional staff to limit the number of permanent staff that are redeployed to COVID-19 response as we look to integrate our COVID-19 efforts into our ongoing operations and restart some of that critical public health work that has had to be paused for the last while. This is reflected in the Board of Health budget proposal that was approved last Thursday, which contained additional investments for COVID in the year ahead. The Board of Health continues to be supportive of all the efforts we do and continues to provide resources and support to our staff. We've also continued to proactively understand and respond to the emerging stressors of our staff through ongoing weekly meetings with our union partners. It is a difficult and persistent challenge to balance the demands of this virus with the understandable fatigue that we are all feeling in all parts of the public health and healthcare system. We have adjusted as we are able to make the days and weeks as manageable as they could be. We have invested in additional mental health and wellness supports for our staff, specifically the addition of psychotherapy and social work to the list of providers available under our organization's health insurance. We've increased the amount that staff can claim for mental health supports. We have mental health days available for our staff should they need them, and a number of proactive and responsive services have been put in place, including regular promotion of our employee family assistant program, counseling support services, and voluntary debriefing sessions for our case and contact management teams during the difficult and tragic situations that they have had to deal with. We've also ensured that people have been able to take their breaks, and with a rare exception, staff have been able to utilize their vacation time this year. The Middlesex-London Health Unit is a workplace that cares for each other and cares for our community. This is a workplace committed to kindness, committed to understanding. The people that work here demonstrate this day in and day out. And we see daily how leaders support staff, staff support leaders, and how staff support each other. All the while continuing to deliver on our mission and mandate to protect and promote the health of this community. And we ain't going nowhere. We remain strong and committed, sure of the critical importance of our work and our ability to do it, and grateful to a community that continues to support us and do their part to end this pandemic together. The Middlesex-London community has demonstrated this commitment to one another by rolling up their sleeves and getting vaccinated. This Tuesday, we celebrated the remarkable accomplishment of 90% of all individuals 12 and over having received at least one dose of the COVID vaccine. This is a milestone. It's a milestone we're celebrating because it brings us all the more closer to ending this pandemic. It's also a milestone worth reflecting upon as we acknowledge and remember the hard work that each and every single one of us has had to do our part and to get us this far. Thank you, Middlesex and London, for this gift that you have given to one another. And as the mayor has noted, that opportunity to get vaccinated continues. The health unit is delighted beyond doubt to welcome children 5 to 11 to its mass vaccination clinics tomorrow. When they opened on Tuesday, in the first 25 minutes of online booking, 5,000 pediatric vaccination appointments were booked, filling all the appointment slots for Friday, Saturday, and Sunday. As of today, over 8,000, nearly 8,300 children have booked a vaccine appointment. This represents over 22% of the population 5 to 11 years old in our region. This community believes in the science. This community believes in vaccines. And this community recognizes how critical this is to care for one another and keep each other safe. And as I mentioned before, the health unit has had massive intentionality and has put massive efforts into making sure that this vaccination experience is as friendly and enjoyable as it can be. We've been working to make sure that these clinics really are places that kids and families are going to want to come to. When our kids attend the clinic, you'll be welcomed by our vaccine superhero who you met last week. You'll see posters and floor stickers guiding your way to a colorful and child-friendly vaccination pod. You'll see television screens in the waiting room with distraction tools available. I've got some of them here. That includes things like these stress stars, which I've got to admit are pretty good for adults too, for the record. For our kids, there'll also be distraction tools like this look and find tool. The look and find tool where you can try and see as a kid. It's harder actually for adults, I think, than kids to try and find what's going on in this cityscape. And to celebrate the fact that our kids are getting vaccinated, we're going to have these amazing stickers celebrating the fact that they've done it, that they've shown up and done their part. And our vaccine superhero is on this to recognize our little vaccine superheroes that are stepping up to the plate. This sticker is for dose 1. And just to remind you how important it is to come back for dose 2, we've got different colored stickers for dose 2. We're ready. We're excited. And tomorrow is a huge and awesome day for our community, for our health unit, and for our families and kids. We're getting there. We are getting there. It's been a grind. We've been at this for a really, really long time, but we're getting there. And tomorrow, we're going to celebrate that as we celebrated on Tuesday, our 90% accomplishment. Thanks to our community for being there with us. Onwards we go. Back to you, Beth. Happy to take some questions today.
Thank you very much, Dr. Summers, and thank you, Mayor Holder, for those opening statements this afternoon. We do have a few questions in queue already, so we will get to those right away. The first comes to us from Jane Sims with the London Free Press. It is for you, Dr. Summers. Dr. Summers, are you content with how many parents have signed up their kids for the shot? Is the uptake what you expected? And have you had any issues or complaints surrounding access to the vaccine?
Hi, Jane. Thanks for your question. With the numbers that we've seen to date, we are very content. We are very excited. And we know that this is just the beginning. We won't be settled, of course, until we are well over that 90% mark, but we are very content with that initial uptake. The fact that nearly a quarter of eligible 5 to 11-year-olds have registered for a vaccine appointment already is a testament to the commitment of this community. We're really delighted with that. At this time, we haven't had too many complaints about access. What we recognize is that parents prefer the evening and after school to the day. We actually intentionally put the clinic hours from 11 to 6 rather than our conventional 9 to 5. And the reason for that was to give more appointment availability into the evening. We'll continue to monitor that, recognizing that obviously that's a time that's more convenient to families. Starting next week, you'll be hearing about some of our other more pop-up clinics in the community at one of our busy local malls. So hopefully we can continue to provide access. Of course, pharmacies and primary care are also coming on board. So hopefully there's sustained access to these appointments throughout the next month.
Thank you very much, Dr. Summers, for that response. Another one here from Jane Sims with the London Free Press. Dr. Summers, has there been any hint that booster shots might become available for all adults sooner than later? Is it possible that they could be approved in December?
Thanks for that question, Jane. Certainly lots of rumbling around when additional people will be eligible to receive the booster dose. A few reasons why it's not yet the case. Number one is that booster dose happens 6 months after you receive your second, which of course for most people isn't going to be until into December and January. The other reason is that in Canada, because of the delayed second dose for most individuals, we've actually seen more sustained protection from 2 doses than other places in the world. When that interval is shortened down to 21 or 28 days, it appears as though immunity wanes a bit quicker. Whereas when the second dose interval is 8 weeks or longer apart, the immunity is sustained. And as we know, here in Canada, many people were certainly at an extended second dose interval. So we're continuing to see in Canada and in Ontario and in Middlesex and London, more sustained protection than other jurisdictions. All that being said, I am sure that the booster dose is going to be a really important part of our ongoing response, and we will see it approved over the next while. I don't know the exact timing on that. Our priority certainly is always to get first and second doses in to individuals, which is why the 5 to 11-year-olds are going to be the main priority for the next month, certainly. Thanks for that question, Jane, and back to you, Beth.
Thank you very much, Dr. Summers, for that response. Our next question comes to us from Jacqueline LaBelle with AM 980 CFPL. Dr. Summers, among those 25 to 39, the rate of active cases per 100,000 population has surpassed the rate for those 0 to 11 years old who have not yet been vaccinated. Why has this changed?
Thanks for that question, Jacqueline. I think there's a few reasons for that. We have certainly seen a reopening of social environments in our community. The reopening and the expansion of capacity limits in places where those aged 25 to 39 hang out has happened in the last little while. And as the weather is getting colder, a lot of those congregate areas are happening in indoor environments rather than outdoors. Therefore, we're starting to see more transmission amongst that group, driven predominantly amongst those that are unvaccinated. The incident rate amongst the unvaccinated population, including those over 12, remains notably and substantially higher, even here in Middlesex-London, than the rates amongst those that are fully vaccinated. So I think it's a combination of the fact that there are still a number of people in that 25 to 39-year-old group who've yet to receive a vaccine dose, as well as the movement indoors as the capacity limits have been lifted. It's a reminder that although we're talking a lot about vaccine for 5 to 11-year-olds, that if you are in the adult population and you've not yet been vaccinated, as a reminder, it's not a matter of if you will get COVID-19, but a matter of when. And that is accelerated as we move indoors. The risks associated with getting COVID-19 are not nothing. They're a big deal, as we've seen time and time again. Get vaccinated if you're in that age bracket as soon as you can. Back to you, Beth.
Thanks very much, Dr. Summers. Another question here for you from Jacqueline LaBelle at AM 980 CFPL. Dr. Summers, with the time between doses now being stretched out longer, will there be any impact on regulations mandating vaccination for youth participation in sports and other activities?
Thanks for that question, Jacqueline. I do not anticipate any changes to the regulations and requirements regarding vaccination for 12 and above in participating in sports and other activities. Although the second dose interval has been extended, the availability of the vaccine for those 12 and older has been now months in place. So there's been a number of opportunities to get vaccinated. We're now nearly a month out from those regulations being in place. And so I do not anticipate any change in that age category for the requirements to be vaccinated to participate in sports and activities such as that. For 5 to 11-year-olds, we are getting questions about whether or not vaccination for 5 to 11-year-olds will be required in order to participate in similar events. That's something we're going to have to evaluate over the next number of months. Obviously, we want to be fair to kids and to families, but I would strongly encourage you to make sure you're getting vaccinated at that 8-week interval. And again, we will see and evaluate what the case rates are at and where transmission is happening early in 2022.
Thank you very much, Dr. Summers, for that response. Our next question comes to us from Jennifer Beeman with the London Free Press. And I know you touched on some of this in your opening statements, Dr. Summers, but we'll still go ahead with it. Dr. Summers, what is MLHU doing to build a better workplace culture despite the stresses of the pandemic?
Hi, Jen. I really appreciate that question. I hope I highlighted a number of the different things that we are doing in order to ensure that our staff and our teams and our people are supported despite the stresses of the pandemic. It hasn't been easy. The balance between the demands of the pandemic and the fatigue of the pandemic are a fine line to walk, for sure. And I think everybody feels that on a personal level here, as well as other parts of the health sector and the public health sector too. We are continuing to try and make sure we've got the right number of staff so that we are not straining the staff that we do have. We are ensuring that we've got a variety of supports in place, and we're ensuring that we listen. We listen each and every day to the challenges that are being faced so that we can try to find responses and try to address some of those concerns, again, while trying to walk that fine balance between the demands of this pandemic and the fatigue that it inevitably brings. Thanks for that question, Jen. This remains an ongoing priority for us here today and yesterday, and certainly moving forward into 2022.
Thank you very much, Dr. Summers, for that response. I'm just going to loop back. Jacqueline LaBelle actually had a quick follow-up in response to your response about the time between doses now being stretched out longer. And Jacqueline was just wondering, what about people turning 12 in January? Just wanting to clarify that age.
Yeah, for sure, Jacqueline. So for individuals turning 12 in January, we do have language within the letter of instruction to provide that grace period for people to get vaccinated if they've just turned 12 and they're following the rules and getting vaccinated. So yes, no, there will be a very, what I hope is a fair approach to making sure people have the opportunity to get vaccinated while trying to also make sure that as many people are vaccinated in those higher risk activities.
Great. Thank you very much, Dr. Summers, for that follow-up. Travis Delaney is next up here from CBC London. He does have a question for you, Dr. Summers. Dr. Summers, can you speak to the increase in hospitalizations this week, up to 24 patients with COVID reported today, including 10 in critical care? Travis is wondering, Dr. Summers, if this is concerning.
Thanks for that question, Travis. When we see increases in hospitalizations, that is concerning. It reflects the fact that we are seeing increasing case counts across the province. Obviously, the London and Middlesex area is a major referral center for people in our region. And we know that in other neighboring jurisdictions, such as Southwestern Public Health, also Oxford Elgin County, have seen a large rise in cases. And we are supporting our whole region from a healthcare perspective. Hospitalizations are concerning. And they do reflect, again, the ongoing risk of COVID-19 in our community, particularly amongst those that are unvaccinated. As I've spoken to before, the risk of getting COVID-19 is reduced by at least 6 times, if not way more than that, when you get vaccinated. And what we've seen in the province is that the rates of COVID-19 amongst those that are unvaccinated is 6 times as higher. What you've also heard me mention is that the risk of getting hospitalized if you have COVID-19 and you're unvaccinated is 11 times higher, and the risk of being admitted to ICU is 26 times higher. That vaccine doesn't just protect you against getting COVID-19. It doesn't just protect those around you from getting COVID-19. It protects you from ending up in hospital. And I think that's a really important component of why the vaccine is a benefit for all of us.
Thank you very much, Dr. Summers, for that thorough response. We've got no more questions in queue this afternoon, so that will wrap our media briefing for Thursday afternoon. Thank you, Dr. Summers, Mayor Holder, for joining us. Thanks to the media for tuning in, and thanks to the viewers and listeners who tuned in this afternoon as well. We will be back to join you on Monday at 2 o'clock. So until then, have a great afternoon and week ahead. Thank you. you.